Okay, good afternoon, everyone. This is Emily Clark, Information Specialist for NCCMT. I'm a coordinator for the Spotlight webinar series brought to you by the National Collaborating Center for Methods and Tools. Thank you to those of us who have joined us this afternoon for the Spotlight webinar series. Today we will be featuring the Guide to Policy Influence Evaluation. Just before we get started, we'll quickly review a few housekeeping items. Please see the chat section on the right-hand side of your screen in WebEx. Please post any questions or comments that you may have during the webinar. We will have a designated Q&A session at the end of the presentation, but feel free to post any questions or comments you have during the webinar, and we'll try and answer those as well as we move along. Please make sure that you post your comments in the chat section and post them to all participants, as other participants may have the same questions that you do. We do today recommend using a wired internet connection as opposed to a wireless connection. And if you do have any issues, technical issues today, feel free to call the WebEx 24/7 helpline, which is posted on the slide. And if you have any minor issues, Rawan Farhan is one of our panelists. She's actually working with me at the NCCMT, and she will be able to guide you through any technical issues, so feel free to send a chat to her as well if you have some issues. After today, the PowerPoint presentation will be made available in both English and French on our SlideShare page. We also will post the English audio recording on NCCMT's YouTube account. These resources can be accessed using a link that we've posted in the chat section. You can't click on the links on the slides, but you can click on them in the chat section. We will have these posted hopefully within a couple of days of today's presentation. So we're going to start off now with one of the first of a few polling questions today. We would just like to get a sense of what our audience is joining us. We're wondering how many people are watching today's session with you. Please select whether it's just yourself watching, if you've got a group of 1 to 3, 4 to 5, 6 to 10, or if you are in a larger group watching together. You can answer this question in the poll question panel on the side of WebEx. And just remember to hit submit once you've selected your option there. So today I can tell there are quite a few people joining by themselves. We have a few groups of 1 to 3 and actually a number of groups of 4 to 5. So that's really awesome to see. We're glad to see everybody there. Alrighty, so I would like to officially welcome everybody to the NCCMT Spotlight on Methods and Tools webinar series. This is our 30th episode of the Spotlight series. Today we will be featuring the Guide to Policy Influence Evaluation. We will be posting links to the registry page for this tool, and we'll also have links for the website in the chat section as we move along through the presentation. Just a quick background on the NCCs. So NCCMT is actually one of 6 national collaborating centers across Canada. We're all funded by the Public Health Agency of Canada. We here at the NCCMT are located at McMaster University in Hamilton, Ontario. The other NCCs, they're scattered across Canada, coast to coast. They focus on specific topic areas and the use of research evidence for those content areas. We focus on improving the access to as well as the use of methods and tools for health professionals in practice within Canada. So instead of being content-specific like some of the other NCCs, we offer methods and tools that can be applied across all different areas of public health. Just to highlight a couple of the products and services that we have available through our website. These are just a few of them. Many of you may be familiar with some of these. Today we're highlighting a tool that is at the top there, the Registry of Methods and Tools. We do offer a number of online learning opportunities through online modules. There are links to research in Public Health Plus and a variety of other multimedia tools for you to use. We do also offer workshops by request. So now we have our second polling question. We're just wondering how many of you today are already familiar with the Guide to Policy Influence Evaluation. So the options are whether you are not familiar with it, whether you've heard of it, or whether you've actually used it in your practice as well. So again, after you select your option in the polling section on the right-hand side, just make sure that you hit submit at the bottom so that we can get your answer. Just looking at this, there are a number of people who, the majority of people are actually not familiar, so this will be a great orientation to that. And we have about 4 people who have actually used it, which will be great. So this should be a great refresher for you as well. So I would like to introduce our presenters for today. So first speaking, we'll have Shannon Bradley-Dexter, who works as part of Innovation Strategy at the Public Health Agency of Canada, as well as Marla Steinberg, who is an evaluation consultant who was involved in the development of the tool. And then we have a user story which will give an example of how this tool was used, and that'll be presented by Anima Anand, as well as Michelle Hopkins, who work at the Bridge Youth and Family Services. So now I'm going to hand it over to our presenters, and we're very excited to hear from them. So Marla, I'm just going to pass the ball over to you.
Great, thank you. Well, welcome everyone, and thanks for your interest in policy influence evaluation. I'm so excited to be able to tell you about this resource that will support your policy influence work and its evaluation. And I'm very pleased to be able to be co-presenting with Shannon and Anima and Michelle. Anima and Michelle, which you'll learn about a little bit later, will share their experience of using the guide for their policy influence work. As you can see from these learning objectives, by the end of the webinar, you should be able to list the complexities of evaluating policy influence and assess how the guide to policy influence evaluation can support your work. Let's begin by getting some information on who is with us today. So I believe the third poll is going to be set up, so please pick your response and hit submit. We're just take the poll, and then I believe it's going to be shown on the screen, or our host is going to tell us what the results are.
Great. So in terms of the results, we can see the majority are actually practitioners who do policy influence work, followed by evaluators, and then actually a number of public health managers, a few funders, and a few students.
Okay, great. Thank you. Have you ever wondered how you get senior decision makers and politicians to take interest in your program or issue? Have you ever wondered how best to support the scale-up of an intervention? Have you ever wondered how to evaluate your influence on policy? Have you ever wondered what should be considered a realistic achievement or outcome for policy influence work? If you answered yes to any of these questions, I'm happy to tell you that the Guide to Policy Influence Evaluation may be just what you need. We're going to start off, and I'm going to turn it over to Shannon to speak, who will talk a little bit about the context for the development of the guide and why it was created.
Great. Thank you, Marla. I'm very pleased to be here today, and I just want to thank also Marla, who is the creator of the guide, and Nima and Michelle, who will both will talk about their experience using the guide and provide a case study from their project, Healthier Together, which is one of the Innovation Strategy funded projects through our Achieving Healthy Weights in Canada's communities. And so what I wanted to do briefly is just talk a little bit about where the idea of the guide came from. I work with the Innovation Strategy, and this is a funding program with the Public Health Agency of Canada. The Innovation Strategy has really two objectives. The first is to fund population health intervention research in very diverse communities across Canada, and there's a real focus, of course, on the evaluation of these funded projects both with the individuals they're working with and within the broader community and policy context. So the goal is really to build evidence about what works, for whom, and in what context to reduce health inequities. So our first objective is to fund population health intervention research. And the second is to understand what makes success and to share these results to inform policy, program design, and other actions to improve population health. So this is what we refer to as our knowledge uptake or impact on policy. And this happens both at the funded project level and also at our broader program level. And the funding is provided in 3 phases to interventions. So the swirl on the right, the first phase is really the initiation and development, and this is approximately 18 to 24 months of funding for the initial design and testing and implementation of an intervention. And then in phase 2, this is really where we move to the full implementation of an intervention, and this is the evaluation stage and implementation in multiple sites, often in multiple jurisdictions and with multiple partners. And this phase is up to 4 years. And right now in phase 3, this is the scale-up of those interventions that are effective. And this funding phase is up to about 3 years, and the emphasis is really on scaling up reach and impact of the intervention. So through each of the 3 phases, it is a competitive funding process. So if we could move to the next slide, please, Marla. And the innovation strategy right now has 2 focus areas for our interventions. One is mental health promotion, and the other is achieving healthier weight. And so each of these projects that are funded are required to undertake a comprehensive evaluation. This is both of the impact of the intervention on the individuals and communities that are involved, but also on the broader policy environment that they are attempting to impact. So this is really, again, to look at the uptake of evidence and the knowledge generated through the project. So we realized through our discussions with the funded projects that there really was a need to develop a tool that could assist to provide a framework to ensure that they could understand the kind of impact that they were having and also follow that impact through the funding of their intervention. So we speak about it a lot as the influence on policy or knowledge uptake that can happen at the project level. So in about 2013, there was a needs assessment done with all of the funded phase 2 projects, and it was determined that a guide would be developed. And so we were happy that Marla Steinberg and Cathexis were able to work to develop this guide, and this has been available for the funded projects for almost 2 years now. It was completed in 2015, so many of the funded projects have had a chance to use this tool to really help them tell their policy influence story. And for the projects, this type of policy influence really varies. In many cases, they're looking at impact in the local systems, such as municipal guidelines or regional planning documents, looking at the changes that can happen at the school level for both the built environment or access to kind of space for activity as well as access to healthier foods. And policies can extend, of course, into housing and education and health services. The funded innovation strategy projects are working in very complex arenas with multiple partners, so it's great to have this kind of a tool to be able to help tell the story of impact on these broader social determinants of health. So thank you. I'll hand it back over to Marla to continue on to explore and define some of the definitions around policy influence.
Thanks, Shannon. So over the next few slides, I want to speak about some of the things you should know excuse me, about the world of policy influence work. First thing we're going to do is begin with definitions. So for the guide to be most useful, we need to make sure that we have a common understanding of what we mean by policy and what we mean by policy influence work. So let's begin by looking at what we mean by policy. As you can read on this slide, we adopted a very pliable definition based on the work put forward by the NCC for Healthy Public Policy. And you can see in this definition when we step back a little bit, we see that policy is really an umbrella term for action, which is kind of interesting because we tend not to think about policy as action and more as a pronouncement. But at its core, policy really governs actions, like what programs will be implemented or what programs will be funded. And these actions can include rules, principles, roles, and responsibilities. This was a definition that was put forward to the IS projects when we started on this work. And as you can see on the bottom bullet, that the majority of projects really resonated with definition and felt that it would cover the work that they were going to be doing in influencing policy. We tend to think of policies only at the governmental level, but policies defined as explicit rules that govern actions exist in all forms of organizations, community-based organizations, businesses, and schools. One of the IS projects was successful in influencing the policy of the RCMP. They got the RCMP to adopt their program and roll it out across the country as part of a suite of crime prevention programs. And depending on the nature of the programming and jurisdictional differences among our provinces and territories, you may need to be working at different levels. A few of the IS projects were engaged in programming for school-aged children. In some provinces and territories, they needed to work with the Ministry of Education. In others, it was the school boards who made the programming decisions. And in others, it was individual schools. So you really have to understand your policy landscape to know who you need to be influencing. Now let's look at what we mean by policy influence work. Here again, we have adopted a very simple yet pliable definition of policy influence. For our purpose and context, policy influence work supports the uptake or spread of evidence-based interventions. It's not necessarily about influencing policy to get an idea on a policy agenda, although it can be. Instead, our focus is specifically about the adoption of evidence-based interventions. While the definition is clear on intent, it's pretty silent on what policy influence work actually entails. And this was deliberate because the IS projects were involved in a wide range of policy influence work. Just to give you a little sample or an example, here's an example of the range of policy influence work that an IS project was doing. This description was provided by one of the IS projects when we asked them to describe the specific policy influence work that they were undertaking. And this particular policy influence work was in support of the adoption of a food security regional plan, a particular type of intervention. Together, this one example shows the range and diversity of what we consider to be policy influence work. You can see the section that's highlighted in red, where they spoke about developing a food security questionnaire that went to all party leaders during a provincial election. We define that as policymaker education. The purple sentence talks about working with the municipality to develop a food charter and food strategy. That's policy development. The blue or green, depending on where you fall on that spectrum, turquoise perhaps, is they say we prepared a fact sheet on food security as a municipal issue. So that's really a public awareness campaign. And the last red bit, which is advocacy, they talked about encouraging people to write in support of including food security in their regional plan. Now, it's important to recognize that there are many other terms that cover the same type of work. As I've been talking and reading out the example, I'm sure there are many of you who have been thinking, hey, this is the type of work I do when I work on my project on sustainability or knowledge translation. And you're absolutely right. As you can see from this slide, there are many other terms that cover the same type of work that we are talking about. We specifically chose the term policy influence because it fits with the innovation strategy. As you will find out when you look through the guide, or if you've already looked through the guide, various resources within the guide use these other terms. And we have retained the terms that they use, but all of them do support what we are calling policy influence work. So went ahead too many. Now that we have defined our terms and we know what we mean by policy and policy influence work, we can begin to explore the world of policy influence evaluation and understand its unique challenges and opportunities. The first thing I wanted to point out is that policy influence is complex. And what do I mean by that? There are lots of programs and interventions that are complex. In fact, I'm sure any one of us would likely be hard-pressed to name any intervention that's not complex. Influencing policy is complex because you need to be doing multiple things, going off in several directions, pursuing many pathways, as this picture shows. Think back to the example of the food security project. As you saw, this group was pursuing multiple strategies or tactics all at the same time, things like policymaker education and public awareness. Harry Jones, one of the authors included in the guide, offers further elaboration on the complexity of policy influence work. And he says that policy influence is a complex process shaped by a multitude of interacting forces and actors. Outright success in terms of achieving specific hoped-for changes in policy is rare, and the work that does influence policy is often quite unique and rarely repeated or replicated, with many incentives working against the sharing of good practice. This means that in evaluation, it's simply not enough to ask or report on whether or not a policy change occurred. And this is one of the takeaway messages that I'm hoping you will actually take away from this webinar. In evaluating policy influence, you need to do more than ask if the policy was changed or adopted. Several of the resources in the guide offer other foci for evaluation and supporting the calibration of policy influence work. We can also learn about complexity from the experience of Dr. Bonnie Ledbetter, who is the director of another IS project, this one in the mental health stream, the WITS project. Here she said, a lot of policy influence is about being there when the window opens and being nimble to jump on board. A lot of policy work is stand up and wait and then jump when you need to act. So the implications of this for evaluation is that there's really a lot of hurry up and wait work. So again, just having a reporting system that asks, did you change policy, will not be very helpful. In fact, most of the time, it will show that you're not succeeding. It also means that the group, champion, or intervention needs to be known. So when an opportunity arises, they can be called upon, or that they have connections to tell them when a window has opened. Both of these speak to the need to evaluate and focus on capacity, capacity building, and capacity for policy influence. And several of the resources in the guide provide guidance on how to do this. It's similar to emergency preparedness. A lot of work goes into being primed and ready for action when action is actually needed. The second aspect of complexity that I wanted to point out is that policy making and policy influence are processes. A colleague of mine, Dr. Bev Holmes, introduced me to a quote that I quite like that provides a glimpse into the policy making process. It's actually from 1869, John Godfrey Saxe, who's an American poet. He said, laws are like sausages. It's best not to see them being made. So instead of showing you a picture of a sausage factory, I used a picture of snakes and ladders game because I think it nicely illustrates a number of points about these processes. First, there actually is a systematic element to policy influence, like the orderly progression across the squares in the snakes and ladders game. Knowing the ins and outs of an organization's policy-making process will help with policy influencing. Basic things are who makes these types of decisions to adapt or adopt a program, and when are the decisions made. I also chose the snakes and ladder games because it's fraught with unexpected surprises, some of which will get you to your goal faster. The ladders, things like when the media attention is focused on bullying, for example, because of some horrific event that took place. And the snakes, things that may set you back, like change of government or a key ally changing jobs. Unlike this board game where you can see the surprises ahead of you, as Bonnie Ledbetter pointed out, a lot of the work is being able to respond to whatever happens. So here I will restate one of my main takeaways. The implications of this for evaluation is that being focused only on the policy goal will not be very helpful to the funder or the project. Part of the work in evaluation is to document the process. The guide has several resources that speak to the focus on policy influence evaluation, being on the process of policy influence work, a variety of outcomes, and enhanced capacity. The third element of complexity that I want to highlight is captured by the phrase that you see here, all roads lead to Rome. This means that there's a variety of activities that can influence policy. Again, we saw some of the diversity in the example provided by the policy influence work of the Food Security Group, which is out of Halifax. The guide contains a number of resources that provide typologies of policy influence tactics or strategies. These will be useful in planning the policy influence work and also in setting up the data collection systems to monitor progress and success and make strategic decisions about the allocation of precious resources and time. Okay, my computer is not advancing my slide. There we go. The fourth element of complexity that I wanted you to be aware of is that there are a variety of policy impacts. Here I borrow from Carol Weiss's typology of research impacts, where she distinguishes between conceptual and instrumental impacts. Conceptual impacts being where you change the thinking of key stakeholders, and instrumental impacts where you actually change actions. Harry Jones, who I spoke about earlier, author of one of the resources included in the guide, offers 5 more impacts. In his publication, he lists different types of impacts that really expand the 2 categories first proposed by Carol Weiss. As you can see here, the first 2 are different ways of having a conceptual impact. Framing debates, which means getting issues on the policy agenda and affecting how stakeholders think about an issue. The second category is, again, a conceptual impact, but here the focus is on the language surrounding the issue. Think about the language and approach to addictions, for example. Does the policy agenda use a harm reduction paradigm or a criminal justice approach, or both? Being able to track and show a change in language and paradigms can be very significant and can really demonstrate an impact of your policy influence work. The third bullet, the one speaking to procedural change, is also important, because if a new process is brought in that, for example, includes the people with lived experience in the policy process, then that is, again, significant and worthy of documenting. It's important to recognize that some of these impacts will not be relevant or possible if the policy goal is to scale up a program, as opposed to just advocating for a particular issue. But they may very well surface in scale-up efforts, and it would not do the policy influence work justice and it would do the policy influence work tremendous justice to include questions that capture these types of impacts. In this slide, we look at the 5th element of complexity, and that's attributing change is difficult. I would imagine that most of the interventions we deal with have elements of complexity that make causal attribution difficult because of time or because of the many interacting factors and players that combine to produce the final results that we see. One way to deal with this is to focus on contribution rather than attribution and be able to collect data that speaks to the contribution the policy influence played in the outcome. Given all this complexity, it should come as no surprise to folks who are familiar with evaluation that theories of change are useful in policy influence work and its evaluation. In fact, I believe they are required. In trying to evaluate policy influence work, like other areas of evaluation, it's very helpful and useful to help stakeholders develop a theory of change. This can take the form of a logic model that identifies activities, outputs, and anticipated outcomes, or a more complex theory of change that surfaces and makes explicit the connections and assumptions between the inputs, activities, outputs, and outcomes. When you're working as an evaluator, it's your job to help people get past the simple idea of if we build it, they will come, or if we tell them about it, they will implement it. There are too many competing priorities for it to be this easy. And this is where frameworks for scale-up are useful because they can point out the many factors that can influence whether something is adopted or not and can aid in the development of this theory of change. There are several resources within the guide that have useful and easy-to-use theories of change or logic models. These will help you and your stakeholders think through the activities, outputs, and outcomes that can guide their policy influence work. The last thing I want to point out about the field of policy influence evaluation is that there are a variety of methods for evaluating policy influence. As evaluators, we all have our trusted toolboxes that hopefully are overflowing with different methods or approaches that we use depending on the context and our client needs. Policy influence evaluation will call upon most of the tools most of us already have in our toolboxes. Several of the resources included in the guide include a list of different methods, and one of the resources actually includes data collection tools. I do want to point out that some of the tools may be more familiar to those of us who have studied communications, and may be less familiar to those of us who came to evaluation from other social science backgrounds. In order to help navigate all these complexities and to help the IS project evaluators and managers navigate the world of policy influence evaluation, we produced the guide. We began with forming a working group of IS projects because, as you might recall, I said the needs of the IS projects were the impetus for the work. With the assistance of the IS projects, we implemented a needs assessment to find out what their policy influence needs were. Based on the needs assessment, we found that projects wanted assistance with finding indicators and tools for policy influence work. They also said they wanted to be better able to tell their policy influence stories in a way that just asking about, did you change a policy, really didn't serve them. But we could not just produce a list of indicators and tools because these really need to be anchored to evaluation questions or outcomes. So we decided to develop the guide to provide full assistance in planning a policy influence evaluation and not just jump in at the indicator phase. So we developed the guide. We reviewed about 35 documents. We identified the evaluation process or step it addressed, its original context for use, whether or not it could be adapted, whether it was freely available, whether it was easy to read and use, had worksheets or other usable frameworks, and added something of value to the policy influence planning process. In the end, we selected 11 resources for inclusion in the guide. Only 2 of the resources were not specific to policy influence evaluation. They spoke to the first step in engaging stakeholders. We couldn't find a resource that contained as helpful information as the ones we were familiar with that were developed for evaluation in general. We gave the guide back to the working group, and they said, oh, these are interesting resources, but we don't actually know what we're supposed to do with them or how we could use them. They asked for examples of how the resources could be used. So 3 of the IS projects agreed to be case studies. We worked with them to document their use of the guide and the resources in developing their policy influence evaluation plans. So the guide offers a limited number of useful and free resources that are organized around the 4-step evaluation planning process. What you see here is a quick reference page that you can use as a standalone document. It has links to all the resources that you might want to look at for each of the steps in the evaluation planning process. As I mentioned, the resources are organized around a 4-step evaluation planning process. You can see the 4 steps here. Step 1, identify and engage stakeholders. Step 2, select the policy influence goals and strategies. Step 3, focus the evaluation. And step 4, choose the data collection methods and tools. For those of you who are engaged in evaluation work, these 4 steps should be very familiar to you. On the right side of the slide, I put up another widely used evaluation framework. This one comes from the Center for Disease Control in the U.S. to show you that our steps are in line with other frameworks, and as I said, should be familiar to you and mirror how most of you likely go about planning your evaluations. The guide also includes 3 case studies of IS projects who use the guide and its resources to develop their policy influence evaluation plans. The cases reflect different targets for policy influence work. The WITS project was working on scaling up an anti-bullying program for primary schools. The Healthy Weight Connection project was interested in scaling up a system change intervention to bring Aboriginal and non-Aboriginal organizations together to plan for services that address childhood obesity. And the third case, the Our Food project, was working on creating a food strategy for Halifax, Nova Scotia. So they were focused less on scaling up an evidence-based intervention and more on policy implementation, but they found the resources were still valuable to them. For 2 of the cases, we were able to include the policy influence evaluation plans we helped the group to develop. Here you see a standard data collection or evaluation matrix that shows the activities the group is going to do, their outputs, outcomes, and data collection methods. You can use these to plan or help develop your own plans, or help groups you fund to see what a completed evaluation plan for policy influence looks like. The guide also contains a number of user insights. Working with the cases also allowed us to capture their experiences in using the various resources. We were able to present what they liked about the resources, what they felt the resources lacked, and how they adapted the resources to suit their needs and context. And this brings up another important point. In our review of resources, we did not find one that we thought would meet the needs of all projects. In policy influence evaluation, there is no such thing as a one-size-fits-all. So we curated these 12 resources that offer something of value, but we fully expect you to pick and choose and adapt as you see fit. It will be helpful if you think of the resources as a set of raw ingredients that can be prepared, adapted, and consumed to meet the needs of your evaluation context. And Anima and Michelle will really speak to how they consume some of the resources. The guide is not intended to be used as a step-by-step recipe, even though I encourage you to think of it as a set of raw ingredients. It's like going to the market. You have to know what you want to prepare to know which ingredients in what forms will work for you, and your groups will provide the recipe. The guide is also not focused on the evaluation of policy implementation, policy effectiveness, or the impact of policy. It's really about the policy influence work, and there are a number of excellent tools not included in the guide that will help you if that's what your focus is. We believe the guide has several different audiences. While it was originally developed for IS projects, we believe it will be of value to others, including funders, projects or organizations involved in policy influence work, and evaluators. The guide is intended for people who are familiar with evaluation. It's not an evaluation how-to. There are lots of great evaluation how-tos out there. This is not one of them. It's for people who know their way around an evaluation and who want guidance in a particular domain, policy influence. We believe the guide also has a number of distinct uses. First, it provides a very short and readable overview of the complexities and challenges in policy influence evaluation. So read it to increase your knowledge and understanding of this domain. We also think that you can use it to develop evaluation requirements for your projects if you're a funder. It can be used to develop frameworks that support projects to collect information on their policy influence processes, their capacity building, and a range of outcomes. The trick is just don't ask projects to report on whether or not they influence their policy. Third, we believe evaluators can use this guide to help plan workshops or to help plan evaluations for their projects. So far, I have delivered 2 very successful workshops, and I know they were successful based on the feedback I got from attendees, where we used 2 of the templates to help groups think through their policy influence goals and their stakeholders. There's a lot of other tools that can be used to engage groups in planning their policy influence evaluation. I'm very happy now to turn this over to Anima and Michelle, one of the IS-funded projects, who are part of one of the IS-funded projects, who will speak about their project, their policy influence needs, and how they use the guide to meet these needs.
So hello, this is Anima. I'm going to start with providing you a little bit of a context of our project and a snapshot of where we have been in terms of our implementation and the complexity of the settings. And then Michelle will talk a little bit of our policy needs, and then we're going to go back and forth between a few slides here. So as Marla mentioned, we are an IS-funded project. We were funded for Phase 1 as well as Phase 2, and we have been fortunate to be approved for Phase 3 funding as well. When we started this project, our project was able to create an innovative family education model that is called Healthy Together. And over the last couple of phases, we have successfully integrated healthy eating and physical activity within group learning to bring families together to learn to make healthier choices and to build healthy relationships. We are also proud to say that we were able to establish and maintain a collaborative national network to guide the program integration within core practice and policy throughout the project phase. To provide you with a snapshot of our project reach, we have implemented the program, Healthy Together, as well as evaluated its effectiveness across 21 sites in Canada, in 7 provinces and 1 territory. Our participant reach is 1,000 or more participants belonging to underserved and minority population groups, including low socioeconomic, low literacy, and multicultural groups such as Aboriginal, immigrant, refugee, and foster families. The diversity of the community settings that these the population groups represent include preschools, schools, health centers, children's aid societies, family resource centers, immigrant and refugee centers, Aboriginal women's support groups, and youth support groups. We have also been able to train over 150 professionals in Healthy Together program across Canada during our capacity building phase of this project. I would like to also highlight the partnerships that we have been able to establish over the project phase, and they are from multiple sectors, including social service, family support, child welfare, education, health, business, corporations, government, not-for-profit, and First Nations groups. So you can appreciate that we do have a wide reach over the diversity of Canadian regions and population groups. So when we look at the program in general, I just wanted to highlight 2 effective approaches that our program has showcased. We're just going to wait for the slide to advance. So overall, our program has demonstrated that inclusion of healthy cooking and eating, as well as physical activity within group learning, is the key to participant engagement that then leads to positive behavior change. And to give you some sample examples from our own program, we found that using that approach reduced consumption of sugar-sweetened beverages, it increased physical activity, and reduced screen time for the participants for the Healthy Together program. We also found a second, and I would say a strong success of an HT approach that we found is that the relationships that developed during the program sessions led to building social support for families, particularly for those who were from the underserved communities. So keep these in mind as you look at the next few slides with Michelle to look at our policy influence needs. So off to Michelle.
Yes, thank you. As we expanded the integration of Healthy Together within core practice across Canada, we initiated the concept of Healthy Together policy influence with our key partners. In this context, having the IS support through developing the guide for evaluating policy influence was a wonderful resource for us. And we also plan to utilize this guide as a key resource for our Phase 3 Scale-Up work plan. In order to be effective, we knew that Healthy Together needed to be responsive to unique participant needs in diverse Canadian communities. We also knew that it had to be adaptable to different settings, contexts, cultural relevance, and compatibility without compromising fidelity. We knew that we needed to build organizational capacity across sites for developing and sustaining practice and policy change, and to enhance knowledge exchange and uptake across partnerships and sectors with a focus on common goals of healthier ways.
So when we got the guide in hand, we were really excited to start the policy influence work process with our key partners. And so we used this guide and some of the tools that we adapted from the guide to engage our partners into the policy influence process, as I just mentioned. You can see on the slide that it seems fairly streamlined, where it starts from policy development to policy adoption to implementation and to maintenance. However, when we started working with our key partners, we very quickly learned that the experience that the process has varies for different settings and different stakeholders. What we learned through our experience is that the process was enhanced by having a common focus, to have a buy-in from all stakeholders to move ahead using a common agenda, and their commitment and investment to create an actionable step toward policy development. So we have used that process a couple of years back with our National Advisory Committee, and we have just reused that process with a set of key partners in preparation for Phase 3 scale-up. We are going to continue to work with our multi-sectorial partnerships and sites, and will be utilizing the guide to measure the overall impact and the process for the policy influence activities that we will carry out for Healthy Together. This slide actually shows the tool that I adapted using 2 resources that were included in the guide. The resources are listed on page 60 of the guide for some of you who have it. The first one was a user's guide to advocacy evaluation planning used by the Harvard Family Research Project. And the second one that we used was an evaluation framework for obesity prevention policy interventions by the Centers for Disease Control and Prevention. And I found there were a couple of areas which I could pick up from these 2 resources to create this tool for working with our key partners. So this tool was to introduce the concept of policy influence work to our advisory members. It also allowed them to brainstorm the ideas about what constitutes a policy or practice related to healthier weights in their own organization, in their network, or in their community or their areas of influence. They worked in small groups to envision the Healthy Together policy influence work option, and they thought about what goals they could focus on within their respective spheres of influence. And finally, we came up with measurable actions and tactics that could be used for them to be engaged in and to achieve the identified goals. The tool was very helpful for the entire group to engage in this process, and not only for identifying the goals, but also really holding them accountable for achieving these goals and actions as we move forward. So this slide actually lists some of the actions that we came up with after the policy influence process that we created with our NAC, the National Advisory Committee. So you can see some of the activities that were highlighted were to measure the program uptake or practice change by the sites, to establish relationships with key decision makers within their own spheres of influence, policymakers' education, capacity building, policy development and maintenance, and policy implementation and evaluation when they reach that level of development and maintenance. We also talked about a couple of demonstration projects or pilots that the individual key stakeholders could carry out at their own level, and obviously electronic outreach through social media, which is a key component of all of the knowledge mobilization approaches now. And we talked about briefings and presentations using the media once again.
So as a result of Healthy Together policy outcomes, we anticipate that there will be adoption of the Healthy Together approach into core practice, that communities and systems will be engaged in the buy-in of Healthy Together adoption, and that stakeholders will be able to leverage partnerships at various levels to support knowledge development, transfer, and uptake that impacts decision-making, with the ultimate outcome that vulnerable children will experience greater equality of health outcomes and achieve healthier weights. The social return on investment costing analysis carried out for the Healthy Together program has reinforced our belief in this theory of change, that if families at risk of developing unhealthy weights come together through programming that enables healthy eating, increases enjoyment of physical activity, and strengthens the family bond, then family members will improve their overall health and overall quality of life with skills and habits that will last.
Thank you, Anima and Michelle. Back over to me for the last couple of slides. Before wrapping up or opening up the webinar to your questions, I wanted to let you know how you can get the guide. As was mentioned at the beginning, it's now available on the NCCMT website. And we know that since it's been available for about the past 2 months or so, it's been downloaded over 100 times. So clearly this is something people are interested in. and I'm interested in how people use it and find it useful. So to wrap up, and then we'll open it up for questions, here's the key messages: that policy influence in order to support scale-up of evidence-based programs is a concern to many funders and organizations. There's actually a burgeoning literature on how to do and evaluate policy influence work. The Guide to Policy Influence Evaluation will help you navigate this literature with a select number of high-quality, useful resources. And the guide can help you to develop evaluation requirements for policy influence work or to support projects and organizations to do and evaluate their policy influence work. The last slide just has our contact information if you wanted to chat with any of us, or if we don't have time to answer your questions in the time we have remaining. So now I believe it will be opened up for questions or comments from folks in attendance.
Yes, thank you so much. This is Emily again from NCCMT. Thank you so much to all the presenters. That really was a fantastic overview of policy influence evaluation. We really do appreciate that. We have now reached the point in the presentation where we will open it up for a Q&A. If you do have any questions or comments, please post them in the chat box. And to make it easier for everybody else to follow along, please send any of your questions or comments to all participants. So the first question that we have is, have you conducted any comparison between your processes and those of implementation science, such as tools from the National Implementation Research Network?
It's Marla. I'll answer that. I wouldn't call them my processes. So they're documents and tools that are in the guide. And actually, we did implementation science is another term that can be used to speak about this work. So we did search. I didn't talk about the type of search and keywords that we did use to find resources, but we certainly searched through implementation science and dissemination as well. So I think you'll find a lot of compatibility between, if you choose to use follow implementation framework, then you'll find a lot of compatibility with the tools in the guide and what's in the implementation literature.
Awesome. The next question we had was whether or not the presentation slides will be available after this presentation, because the guide does look very helpful. And the answer, I can answer this one, yes, we will post these slides on the NCCMT SlideShare website. I'll ask Rawan to maybe post the SlideShare link again so that we have that. And then the next question is, you mentioned the priority areas for Public Health Agency of Canada's innovation strategy are currently mental health and healthy weight. How often do those priority areas change? Is there information about eligibility criteria for funding?
Great, thanks for the question. This is Shannon. I'll answer that. Yes, so this round of funding, these three phases, have focused on mental health promotion and healthy weights. And we're looking at planning for what the next focus area will be for the next round of funding now. That planning is beginning. So it may or may not change. We are not sure yet, but we are also in the process of launching a website about the innovation strategy and updating all of that information. So for anyone who's interested, if you could please email me. My contact information is in the presentation, and we can send you the update when our website has been launched, and there you'll find out about all of the past funded projects and also alerts about what's happening moving forward. And the innovation strategy also has a social media plan, so there are Twitters and updates through LinkedIn that you can follow that come out of the Public Health Agency of Canada's account. But I think if you are interested in future funding or more details about the program, the best thing would be to just email me directly, and I can add you to our distribution list so you can see those updates. Thank you.
Wonderful. The next question, could you please discuss what methods were used to search for resources and how you decided which resources to include? Was it only gray lit, or did you look at peer-reviewed literature as well? Were any quality or critical appraisal of resources carried out prior to selecting the resources?
Okay, that's Marla. I can speak to that. We didn't. We looked at all the. We looked at both gray literature and peer-reviewed literature. We began with our own knowledge bases because we were familiar with resources in the area. We searched specific organization websites that we knew were working in the area, and we did a number of keyword literature searches. We didn't use a specific appraisal resource for looking at the quality or appraising the tools. We did work with our working group in coming up with criteria that they wanted to have in the final list of resources. So we kind of developed our own, but with knowledge of the types of things that are typically included in some of the existing appraisal tools. What else? Yeah, so we did cast our net widely, and one of the most, as I mentioned, a couple of the criteria were that the resource was freely available, but also that it was seen as having a value add, easy to understand, and useful to them. And we didn't have, there was two of us who reviewed all the resources and came to an agreement. We did use like an Excel type spreadsheet to rate our, to describe more than rate the resources, and came up with the final list using what we thought and what the working group found would be useful to them to have. So I know there's some additional questions in the chat. Do you want me to respond to those, or?
Sure. I'll read them aloud for you, just so that everybody can hear them as well. The next question was, how important do you consider prioritization and adaptation in a Latin American context? How adaptable do you consider the guide? With a note that the question that he has worked in Europe, and they are almost not adaptable in that context.
So we didn't specifically assess the many contexts where the guide or the resources could be used. That would be an interesting undertaking, considering there's probably an infinite number. Again, our focus was IS projects, so we wanted to make sure that that first and foremost it was adaptable for them. And I guess I invite you guys to do that. It's a resource that's freely available, and have a look at it and see what things you can adapt to your particular context. And I'd be really interested in hearing your experiences with that. Most of the resources are from Canada or the U.S. There's a couple from Europe, I believe. We weren't specific. Obviously, one of the criteria for inclusion was it had to be in English, because most of our IS projects are French or English. And on our team, we didn't have the ability to go through French resources. So we didn't limit it to only North American resources, but I invite you to see. Again, we really wanted to create a set of resources that we believe can be adaptable, but it's only really when you try and adapt them and see what things work for you. And again, remember, this isn't a recipe, right? So
yeah. I might just wanted to add, this is Anima. When we looked at the couple of resources that I went through, really you can't just pick it in as it is. You need to adapt it even to settings that we work through here. And I would encourage for Latin American settings, if that is the specific question, is to read through what is available in the resource and then think through how you're going to be asking those questions with your key stakeholders and develop a tool for yourself. So it's almost like tailor-making from the resource, but really using the language and the way to address that issue by how you know that group well. I mean that's what we try to do here.
And I also think if the specific categories for some of the tools don't really fit your context, then you can adapt them or add more. So, for example, one of the tools talks about 5 or 6 policy goals, but if in your particular context there's a different view of policy or different view of the goals that you want to try and achieve, then to me what you're taking from the guide is you need to focus on what your goals are and not necessarily use those particular goals, but have a discussion about what your goals are. So again, I really see it as a set of raw ingredients for you to use and tailor to your context.
Wonderful. We did receive a response from the question asker saying #challenge accepted, so it sounds like that was a great answer. So moving on to the next question. The question is, despite complexity, my experience with some funders is that they want evidence of direct program influence on ultimate outcomes. And they're asking, how do you negotiate an evaluation approach that accommodates both demands of both complexity and direct evidence of influence?
Great question. I'm hoping that, as I said, I think one of the uses for the guide is for funders so that they can also develop a realistic expectation of what is realistic and achievable in policy influence. So I think if everyone kind of starts from the same base, you have a greater chance. Now, I've had experiences where there are unrealistic expectations for what programs can accomplish in 6 months or 1 year or even 3 years, but I've also seen over time funders becoming much more responsive to how change actually happens. And I think the innovation strategy is one example. As you saw from one of Shannon's slides, well, actually she spoke to it. It's a 3-phase funding approach that takes place over 7 or 8 years, up to 9 years in total. Yeah. It'll be 10 years. So, you know, you've got 9 years to really work on creating the conditions where you can be scaling something up. So the idea, and I have seen other funders who expect you to scale up after 2 years or 3 years and have changed the world. So I think it's both. I think there's an onus on funders to really educate themselves about what is realistic and have meaningful outcomes that can be realistically achieved, and to have longer funding zones. I know in Ontario, for example, the Trillium Foundation is funding more collective impact initiatives, and they've got like a 10 to 15-year time horizon for that type of work. And it's not that they're giving them funding in year 1 and say, give us your final report in year 15. It's a recognition of some of the processes and steps that they'll be taking along the way and what success looks like at each of those. So I recognize and appreciate that this is still a challenge, but I think resources like this can help open up a conversation. And I believe with the innovation strategy and things like the Trillium Foundation, we are seeing more, I would call, appropriate funding strategies. But as we said, like the impetus for this was, you know, the innovation strategy, and the projects were still, even though they had this long time frame, they were still struggling with what it is, how to, and they felt, and you know, in the initial iteration of, I think, some of the reporting requirements, it was a simple question, did you change policy? And projects really felt, or we heard from them, that this didn't let them tell their story. So I think it's a continual process of policy influence for funding policy influence. How's that?
Perfect. The next question was whether or not there are any hard copies of the guide available either at a cost or for free, or is the guide only available online?
It's only available online, but you can print it out. The quick reference page is really useful. I would suggest not, well, so I have it pinned up to my bulletin board, but I also have it online because it's got clickable links so you can get ready access to the resources that are there. And then so far, there's a couple of go-to resources that I've used several times, so I just print them out and download them. But they're really, and here's one of the challenges, who would pay for it to be printed out, and it costs a lot of money to send it. So it's really a self-serve resource.
Great. We have another question. How early or at what stage do you recommend commencing the 4 steps in evaluation and planning? Do you start the steps during the policy formulation process?
Absolutely. So the best time to plan an evaluation or to start thinking about the evaluation is when you're starting to think about your intervention. That doesn't mean that what you create is not changeable, but you have to start thinking about, and really one of the benefits of thinking about evaluation from day one is it really focuses you to think about what you're going to be doing and what your outcomes are in a way that kind of other planning models don't necessarily force you to do. So start thinking about evaluation from day one, but recognize that you may not have all the information on day one to really fully develop your evaluation plan. But by the time your project plan or your policy influence work is scoped out for a year or 2 years, you should have, you should know what metrics you're following, what indicators, what your outcomes are, because I don't know how you pick activities if you don't know what outcomes you're trying to achieve. But I say that as an evaluator because it's a very useful thought process to go through to help with program planning.
Awesome. The next we've got a comment and a question. I liked your point about focusing on contribution versus attribution. Are there ways to evaluate degrees of contribution, i.e. how much of a certain initiative of project contributed to changes that have been observed?
So I'd point you to two streams of thought. One would be John Main's work on contribution analysis, and he's got a lot of very accessible publications on how to do that. The other is the social return on investment type work, where they actually go through a process of calculating the percentage of change that's attributable to the particular program that you're doing.
Perfect. All righty, so we've reached the end of this batch of questions. I'll ask our participants, don't go anywhere. We do have a couple more polling questions. We'll wrap up the Q&A for now. If any more questions trickle in, we'll address them before we wrap up. But for now, thank you to the presenters for a great discussion. That was very informative. One of our last polling questions, we want to know whether you think that this method or tool, the Guide to Policy Influence Evaluation, could be useful in your own practice. And the options range from very useful to not at all to whether you're not sure. So make sure that you select your response along the side and make sure that you hit submit so that we do receive your answer. We'll wait a couple of seconds while the answers come in. So far I can tell that most people do think that this will be either at least very or somewhat useful in their practice. So that's really encouraging to see. It does look like a really fantastic resource. So that's wonderful. We do value your feedback. Your feedback is incredibly important to us. We have posted a link in our chat section, which contains, so it's a link to a survey regarding the webinar. The survey will allow you to provide any feedback you may have on the tool and on the Spotlight series as a whole. We really do use this information to help inform the webinar series itself and select methods and tools to feature in future sessions. Again, the short survey is posted in the chat section, so please make sure that you fill that out for us. We would really appreciate that. And then next we were also wondering, we're interested to see how many of you actually do end up using this tool in your practice. So we were wondering if we would have permission for you to receive an email from the NCCMT, most likely from myself, with a follow-up survey in a few months to see whether or not you have really found this tool useful. So make sure you select your option there. It's totally fine to opt out, but this way we will have your email address and we will contact you in 2 to 3 months with a brief survey, just a couple of questions. So we appreciate everybody who has accepted that. I would like to point you to our next webinar in the series, which we do these monthly, but the way the dates worked out is actually in a week today. So the topic will be the CDC Clear Communication Index. The link to register is in the chat window, so you can click on that to register. It'll be at the same time next week on Wednesday as well. So we're really looking forward to this presentation as well. So please be sure to sign up if you are interested in that topic. And then our last polling question, we're wondering what your next steps are. I think you can check all options that apply, what you think you might be doing with the information that you've gained today during the webinar, whether you think you might access the tool, the guidebook, read the NCCMT summary in the Registry of Methods and Tools, consider using it in your practice, or telling somebody that you work with who might find that the guidebook useful to them as well. So we're actually seeing a pretty even split across this, with most people saying that they will access the guidebook online, and then a fairly even split with everybody else for the other options, so that's really encouraging. I'm just going to check and make sure there aren't any lingering questions. Oh, one more question. Do you mind repeating the 2 resources you mentioned for the last question about evaluating contributions?
Sure. So I've noticed in the chat function that every time I mention something, you show the link for it. So the first one was contribution analysis. There's a number of publications by John Mayne, M-A-Y-N-E, Canadian. Woohoo. And the second set of resources, of which there are many, are social return on investment. So Google that. And it's a methodology that has emerged over the past couple of years. There's one organization in Canada that's kind of the leader, and that's called SIMPACT.
Yeah, SIMPACT Strategy Group. They are based out of Calgary and Toronto, I believe.
So you can Google SIMPACT,
SIMPACT.
Yeah, and you'll find out they have a very comprehensive methodology for doing social return on investment and assessing the contribution of your project to the outcomes achieved.
Wonderful. All righty. Well, it's been a pleasure to host this webinar with our group of presenters. Thank you to everyone who joined us today. It did make for a really great discussion, so we want to thank you very much. We hope to see you at next month's webinar, which will take place in 1 week today. So we want to thank you so much for your time today.